Hey, what's going on, everyone? Dr. Taylor with Aspire Chiropractic. Today, I want to talk about improving your brain with chiropractic. IRO. That's a brain. Trust me on that. So, everyone knows chiropractic is fantastic for neck pain, back pain, and headaches, right? It's the main reason people seek out chiropractic care. But chiropractic care is fantastic, wonderful. I mean, hell, it's more adept than any other healthcare profession in improving brain activity. Apparently, I need an adjustment. How does it do that? Okay, so a couple of things. Actually, we're going to use this right here. So this is your brain, okay? Coming out of your brain is your spinal cord. Goes all the way down like that. We've got 7 bones in our neck. We've got 12 bones in our mid-back, and we've got another 5 in our low back. Now, that's important because these bones protect our spinal cord, right? Our spinal cord and our brain are so important that whoever designed this thing, these are the only 2 structures entirely encased in bone. Now, we've got a cage that protects our heart and our lungs, but these are the only 2 structures encased in bone, right? So the brain has to make sure, the brain has to make sure that it's doing 2 things. 1, sending clear signals out of it, down into the spine, and as such, out into the body through all these nerves that come out here. But not only that, this whole body's got to work. So if there's an issue with a muscle, with an organ, with a cell, with a tissue, we have to be able to get that message back up to the brain. So what could stop that message from flowing smoothly, either out or in, from above down or from inside out, right? If we've got any kind of misalignments, subluxations in these bones, that's going to affect the message going out from the brain or the message the brain is receiving. Because if we'll just take a joint segment here. Here's one vertebra. Here's another vertebra. Like that. And these holes right here between the bones, that's where these nerves come out. So we've got our spinal cord going right down the middle like this, and sneaking out between these holes in these vertebrae are where the nerves come out. So if there's some sort of dysfunction in this joint complex, some subluxation, some bone that has lost proper juxtaposition with the segment above or the segment below, it's going to affect the signal traveling through those nerves, whether it be the signal out or the signal that's going back in. And in so doing, it's going to give the brain bad information. Not necessarily wrong information, but just information that's going to be less than ideal, less than what we want for this thing to be able to operate. So how do we fix this? Obviously, coming from a bias standpoint, it's right up my wheelhouse. We got to assess the spine. We've got to assess every single segment of this spine here, because it has been absolutely proven beyond a shadow of a doubt that when you get adjusted, it increases what's called activity in the frontal cortex, okay? Stuff going on up here. Basically, you got brain fog. This will help reduce the brain fog. This allows the brain to process information faster, okay? Number 2, if we've got poor posture, right? Got the right color here. If we've got this poor posture, if we've got this slumped forward, humpback kind of thing, shoulders forward, thinking like Eeyore or something like that, people with poor posture have poor brain activity, because this is sending a constant barrage of signals into the brain that are detrimental, okay? It's sending signals of being closed off, of shortened muscles. We're compressing all of our organs in here when we're like this. It's sending distress signals to the brain. We change the posture, we change the brain. It's really quite simple. We check this thing called your spine that houses your nervous system, because again, all the messages going out have to go out clear, clean, and smooth. All the messages going back have to come back clear, clean, and smooth. We don't want a static connection between the brain and this skin-covered meat sack that we call a body, right? We want this thing to work and function as optimally as possible. And the easiest way to do that is to make sure this fuse box of a spine that houses the nervous system is free and clear. So we get adjusted. It increases activity in the brain. We fix our posture. It increases positive activity in the brain. It reduces all the negative signals coming in. Not only that, the adjustment reduces cortisol levels. It reduces the effect of the stress hormone on the entire body. What does cortisol do? It makes you hold on to fat. So at the very least, If you follow the bouncing ball, there's a really good chance if you get adjusted regularly, your diet will work better. There's a little bit of a stretch, but the point still stands. So chiropractic increases brain activity well beyond just the regular neck pain, back pain, and headaches kind of stuff. So this is something that, man, it just, no pun intended, strikes a chord with you, hits a nerve, if you will. By all means, give us a buzz, walk right through that door, right here to Aspire Chiropractic. We're ready to help you when you're ready to be your best, naturally.